Oh, I'm sorry, yeah. We'll call the meeting to order, Health Committee, November 3rd, 2015, 9:30, 9:42. Are there any public comments? Any public comments? Seeing none, we'll go on to agency report. E?
Obviously, we are still without a state-time budget, so many of our grants at the health department are not being paid out. We are sending our monthly expenditure documentation forms. We're actually getting them approved. They're being vouchers, but their state comptroller can't issue any checks until this is my state budget. So right now, what we are being paid for, if you want to real quick, go ahead and take a look at that grant and contract work. What we're being paid for are the things that are federally funded, and that is WIC and public health emergency preparedness, and then some little tiny portions of some of these grants. But most of it, the state supply programs, we're obviously not being paid for. Things that are contracted, like our school contracts, our school nursing contract, contract with Migrant Head Start, those things are service contracts are being paid as well. But the biggest portion of this list is state grants, and so that's a major concern. There's a lot of speculation going on in the state, and I spoke to you last month a little bit about what some of the other health departments are going through. Health departments are literally out of cash and having to lay off staff and reduce hours and take furlough days and all kinds of other things. We're not in that situation, and I'm very, very grateful that we're not in that situation. So I'm going to kind of keep around where I was going to make some notes here, but one of the big concerns that came out last week, and I'm going to go ahead and read this to the Health Committee. I received an email on October 27th from Craig Kennedy. He is the Illinois Association of Public Health Administrators president. And he sent us a letter that said, "Dear colleagues, as in the past several months, anxiety continues to rise due to the budget impact. Rumors, statements by legislators and media publications and reporters produce concerns that generate panic mode for many of us. There's been worry about the budget in the past, but with this unprecedented time of no budget, we need some firm reassurances. Friday we heard that the state may not reimburse costs back to July 1st on grants funded through the General Revenue Fund. To address that concern, we contacted Barb Payne from DHS and Michelle Gentry-Wiseman from IDPH. And they got responses back from both of those people. Barb's response, in quote, on the email, says, "This question came up in the Social Service Advisory Committee meeting just this afternoon. They were advised that the intent is still to reimburse back to July 1st. If the budget passes and appropriated amount is different, we may have to address that, but the intent is to reimburse back to July 1st. And then Michelle Gentry-Wiseman of the Illinois Department of Public Health had a similar response several times in our meetings and via email. She said, obviously everyone has to use their own judgment, but Barb's response was consistent with the responses we have heard since last July from DHS as well as from IDPH. I have neither more additional insight nor more control over what happens than you have, but my belief is that we will get reimbursed back to July 1st for all grant programs." And then she has a capital start bold letter that are underlined, for which we received signed agreements. So I wanted to assure you that everything on that grant and contract list we have signed agreements for. The difference on this list, when you look at that last column, and it says, sometimes it says contract finalized or contract signed. What it is when we need, so that you have an understanding of that process, when we fill out an application for a grant, and then we get state notice that we're approved for it. They will then send us a contract for our signature after the grant has been approved. So if it says the grant signed, that means I signed it and send it back to them. If it says finalized, that means they signed it, the final contract, and appropriated copies out to everyone. So that needs to be. So every grant that we have has been approved, and at least has my signature on it. They've offered me a contract and I've signed it. Stating that we'll perform the services for that amount.
Finalizes everything but disbursement.
Yeah, that's basically it. Yep. So we do have signed contracts that, now, not all health departments have signed contracts for all their grants, because as I spoke to you last month, I explained that there are a lot of grants out there, but we happen to hold grants that are on the priority list for the state. So I'm confident that we'll get funded. One, the state budget is fine, and they can appropriate money now to the state comptroller. We're also receiving our fee-for-service money. So we're receiving, private pay money and money for, wells and septic and food prevention and, all those kinds of things that we do with the nation. We are also, I was notified by Melinda Hillman, who's the administrator for Livingston County Health Department, that she last week that she started getting her Medicaid payments. So we've been told that because a lot of the Medicaid payments are, cash through, some of that federal cash through that, and there was also a lawsuit that the state lost them to pay that. So we should be getting that money in short order. So that will help with us. I did ask Yvonne yesterday to run a financial balance for me, and financial balance as of October 30th was $633,086.07. Our operating costs, as I reported to you last month, are somewhere around the neighborhood of between $119 and $120 a month. $119,000 a month. I'm sorry. So that means that this time we still have approximately a 5-month reserve. So hopefully that will get us through this budget. That's the money we currently have on hand. We will be getting money in. One of our big money months for the environmental department is next month. Next month, all restaurants and all food permits are due in December. So we'll have that money coming in. That should bring us anywhere between $43,000 and $44,000 in just that alone, not to mention all of our other regular speaker services. So I do also want to assure the health committee that we're looking very closely at our travel. I've already informed the staff that if a webinar or a phone conference is offered, then I prefer that they do that rather than travel. Although we all know that if they go to those meetings, the networking that occurs, they're so valuable. But right now, we have to make priorities, and so if it's offered via webinar, if it's offered via a phone conference, that's what they're going to do, and they are understanding of that. So it's non-essential travel. Even things like the restaurant inspections, when we start going back out in January 1st and start really doing those again, I've asked the environmental staff to do the close ones first and the farther ones later, so that our mileage stays down until we get some of the payments in from state. So just little things like that. Another example would be our flooring. We had, if you look at our budget, we had in capital improvement $7,500. And we had decided that we didn't need the door that we had planned for, but what we needed was the flooring in that lab. The flooring was not good. But rather than replacing all that flooring, we found someone who will use a strong enough chemical stripper that thinks that they can buff it and get it shined up, and I don't know what the proper term is. It has on his invoice, but and he'll do all that for $575. So instead of replacing the floor, we're going to wait and clean it up as best as we can. So we're going to make that's just one example, we're making every effort to have as much reserve at the end of this fiscal year as possible to help carry us through the times where we're not being paid for those rains. As far as our IMH program,
I don't want to interrupt, but as I noticed, the majority of the grants are in fact finalized. It would look at just as a general look at, so it sounds like a good situation. So
yeah, I'm very confident that once the state budget passes, we will get those. In fact, I did bring this with me too, and I didn't know how much detail you wanted to get into it. For example, which is federally funded, I received a letter on October 15th that says that they're pleased to inform us that we received an additional $619 for FY16 funds for WIC. So our WIC went from last month that I gave you, probably the WIC was $80,780, now it's $81,399. So we have that in the letter that I just got that increases that amount by $619, which is huge, but every little bit helps. So we are, at least providing most of the services, either the services we directly provide or have contract through IMH are priority services. The WIC numbers are down a little bit across the nation, everywhere. I've listened to several different webinars and phone call conferences lately. WIC numbers are down, really down in the state of Illinois because the WIC just had some major changes in the fall. For example, they went from offering on the WIC vouchers 2% off to 1% off only. So a lot of people that don't want that, don't follow up or continue to participate. And that's just one of the changes. There are many, many changes that have been made recently. So July 1st, the state changed their WIC requirements, and they then changed our assigned caseload. So our assigned caseload went from being 619 down to 557. But for September, their WIC caseload was only 408, which is 73%. This time last year, they were running 83, 84%. But we're running 73%. That's not different than anywhere else in the state. But with that lowered caseload number, the services have been lessened, and they're only serving the WIC. They're closing the WIC office on Friday afternoons now at IMH because they can serve the clients that they have during those other hours, which is a cost savings to them and also to us. But the HFI, the Health and Families in Illinois numbers are up a little bit. Family case management is down. But they are, but the state lowered their caseload, and they're running at 130% caseload. So they're doing better than average throughout the state for family case management. But right now, we're still operating under an addendum extension off of our last contract that really ended June 30th with your criminal law hospital. But because there was no state-funded budget, we did an addendum extension and are operating on the same contracts that changed the dollar amount. Last year, what we paid them was $333,333.33 a month, so close to $400,000 for them to do these programs. This year, it's $26,812, I think. information, exactly like you said, Liz, and put it in front of you. You know, because obviously if you look at the amount went down a little bit. That's where we are for those programs. If you look at the anybody have any questions about the IMH program? The IPHD program, we'll still see our summary report. I know the print's getting small. We add a month every month so that you can see this throughout the fiscal year. The print's getting pretty small on that. So these are numbers. It's pretty self-explanatory, and I go over it with you every month, so I won't go over line by line with you this time because I have so much information to share with you. But obviously, the childhood immunizations were up for the last few months. The October 15th deadline now is passed for the school requirements for Illinois State Board of Education, so we'll see those numbers kind of drop off again. We have done, so far this year, we have done, between September, not late September and October, we've done 31 flu clinics. 24 of those were public clinics, and 7 of them were private clinics, like for a business or a doctor's office or whatever. We've given, I initially ordered 850 doses of flu vaccine because last year we ordered 800 and we ran out, and I didn't want that to happen, and so I ordered 850, but our numbers are down a little bit. So far we've given 612 doses of flu vaccine. So, and then I sold 50 doses to Livingston County Health Department last week because they were in need, and I knew that we wouldn't need it, so I told them to bring that to them at our cost. And we still have 188 doses left of flu vaccine. We're giving it health. We still have the County Employee Health Fair on the 12th and 13th, and several other small places that had asked us to come and give it to their staff. We're taking walk-ins. When I was coming over this morning into the meeting, somebody had just walked in the door and said, "Where do we go to get a flu shot?" So I directed them. So we're taking walk-ins. So I don't think we're going to run out this year, and that's a good thing. I don't like to turn people away. If you'll notice that we have a little increase in chlamydia cases this month. When you reach a 50% increase from that in a case from the previous year, it's outbreak status. So let's say you had 3 cases last year, if you climb above 6 this year in that month, you're classified as outbreak status. I worked with the state, I explained some things, I told them that, we're increasing our education programs in the school, so forth. But even a small amount of that can put us into what the state considers an outbreak status. So, there is a little increase. The nation is having an epidemic with HPV. HPV, the human papillomavirus, is a virus that leads to genital cancers, cervical cancers in women, and not cancers in men. And HPV also causes condyloma, which is the genital wart. And there's a national outbreak for that. I've spoken to you many times because that's our #1 pipeline priority, is to prevent those types of cancers through vaccine prevention, diseases that are preventable. Yeah.
I think rather than percentage-wise, like they're figuring that out, that they would go by a population, county population or something, when they figure this, like you say, is outbreak status.
Yeah.
Because that's totally off the wall.
Yeah, it is. And our numbers are very low considering our surrounding counties, but let me explain why our numbers are low. Because do I think that these numbers, these are our actual numbers, those are the numbers we get out of IMH. So those are our actual numbers. Do I think that those are really our true numbers? Now there's a chance. And the reason is because I explained this to the health committee before, but we do not have an STD clinic here. state will federally fund through Title 10, family planning or STD clinics, to a county, if another county has an STD clinic within it used to be 60-mile radius, or 50-mile radius, now it's 60-mile radius. Well, we are within 60 miles of Kankakee County Health Department, of Champaign County Health Department, so we're not going to ever get that funding for that. It's just not going to happen. So what we do then is we refer the teenagers and the people who are, by far it is a teenage population, and that's a very big generalization, but it is. When we see these cases, by far it is a teenage population. It's not the grandmas and grandpas out there. Present So we refer them for testing to our surrounding county health departments. And because some of those surrounding county health departments have free and anonymous testing, they can actually just go in and get a code number and then do the results by code number, and they don't have to report that they're from Iroquois County. So then those reports are substituted to stay on the county report. So our numbers look like we're so great, in preventing this, but we're just like everybody else. The need is there. That's why it's so important that we're out there doing that education and making sure that we're offering vaccines that prevent them. So last week, several of us to training, Vonda, the director of nursing, and Cheryl, who's the IPLAN coordinator, and I went to some training on how to increase your uptake, and how to make it more marketable for people to come in and actually take advantage of the vaccines that prevent cancer.
Isn't there an age window?
There is. The HPV vaccine is for ages 11 to 26. Now, the Vaccine for Children program will pay for that vaccine. We get state supplied vaccine for that for 11 through 18 years of age. And then once they turn 19 years of age, it used to be private pay, but then earlier this spring, when they came out with the Vaccine for Adults program, that now applies back. So anyone that under the age of 26 and under can come to us. 11 to 26 can come to us, and we can give that to them through those programs.
Tuesday at 10 o'clock.
But we're actively working on maybe partnering with the juvenile justice system. I went to the juvenile justice council meeting last Friday, and we discussed how they were talking about alcohol use in the county health. The surveys are showing increased alcohol. Well, that also, anytime you see increases in alcohol, you see increases of STDs, and some say, well, alcohol doesn't cause STDs, and I said, oh yeah, it does. Because when people are intoxicated, they find themselves making bad choices, yeah. They participate in risky behaviors that they wouldn't normally participate if they were thinking clearly. So, that's the one thing we noticed for sure when we wrote the last plan to become a certified health department, was that every time you saw a spike in alcohol rates, you also saw a spike in STD rates. So that followed very closely. So because they're seeing all these increases in alcohol rates, as you can see, we are seeing increases in STD. So we're working on that. It's our job to get out there and to do everything that we can do to educate these individuals so that if they're going to make a decision, it's an informed one. So that's pretty much about it. We're looking at the new building system that is so important. About 40 different health departments in the state are looking at this building system. It won't reduce our workload at all. We're still going to have Sandy inputting this all into the system. But what it does is it allows us to take private health insurance. So We've had, I noticed this year, at least with a few flu clinics that I actually gave shots at, that we are turning away more and more people who would like to come into the health department and, come to one of our outside clinics, but they don't want to have to pay up front for the vaccine, get a receipt, and submit it to their insurance themselves. They would like us to bill their insurance. So we're losing clients that, turning away clients that we don't have to turn away. So we're looking into a billing system called CDP. Like I said, about 40 different health departments within the state are signing up for this. Kankakee County signed up for it, Livingston County, McLean County has signed up for it. Lots of surrounding counties are doing this, and they're able to take health insurance. So I applied for a little mini grant through the Illinois Public Health Association, and they have sent me a letter notifying me that we will be awarded the full cost of the setup for this billing program, and that's $3,000, and they will pay the full cost. And Tom Hughes from the Illinois Public Health Association asked how we wanted to do this, and I said, well, I would like for you to just send them the payment, send the company a payment, and then when we're ready to get going, because I need to approve at health committee, I need to talk about it with my board of health. It's on the agenda for the board of health meeting. Although we talked about it before, and they asked me to continue to look into it. What it will cost us is a user fee of $125 a month to use their billing system. But they will be able to claim money on claims that we submit that a lot of times we get denied and just lose it. And they're getting big rates back. And the health departments, surrounding health departments, are saying that they are very pleased with it. Now, the other thing, the only other cost that there is the $125 a month. There will also be, if they help us get credentials with all these different insurance companies, I budgeted $1,000 in our FY16 budget because they charge $100 per company to help you get the contract with those like Blue Cross Blue Shield and United Health and all those things. So I have that budgeted. The other thing is that in order to use the billing system, then you give them 14% of your profit. Well, 14% of our profit is about equal to what we lost last year in flu money billing through Medicare and Health Alliance and all those places on claims that got denied. So this should help us in the long run be able to give it to a lot more people. And of course, it's nice that we can make some money on it, which we expect to do. But the really nice thing is we'll be increasing the immunity in the community and hopefully preventing the spread of diseases that are community. I hope I explained that one a little bit. So it should be win-win, and all the health departments that are at first, I reported at the last board of health meeting that a couple counties had a few glitches. Those have been worked out. They're very happy with the system right now. So we'll be looking further into that and hopefully going with that. I can always turn back over. That's why I didn't have them pay us the $3,000. I had to pay the company because if for some reason we don't go with that, they can appropriate that, the company can appropriate that grant money to another health department. Make sense then?
As long as John said that. As long as John said that.
I know today was a lot longer. This is how we usually go. I just have a lot of information to share with you.
Thank you. Any questions, Steve? Thank you, Dean. Have you had an opportunity to look at the claims? Do you have any questions on the claims? Anybody want to make
I'll make a motion.
Brad and a second?
Second.
Ed? Any discussion on the claim? Motion to move the claims to the county board and seconded. All in favor, say aye.
Aye.
Opposed, say no. Motion passed. Old business. Yeah. Yeah. What was the discussion in finance? Can you fill us in a little bit?
Are they gonna meet monthly then? The reason we got the claims to start with is because they didn't meet monthly. How can you approve something?
I think they are meeting monthly now. I happen to disagree when I read the statute, but when I read the Attorney General's opinion, I guess it makes sense. So it would be my suggestion that we...
Lisa Manning?
No, long before her. That was the handout that we got last month from John. It would be, I guess, my suggestion that we, whatever we have to do to have that happen. What would be your suggestion, John? We just make a motion that you do it and we don't? I do have pause for about the separate committee. I would sooner see a Board of Health meeting, but not mind to determine. I guess if the state attorney says it's okay.
One thing I guess I would propose also for yes, that we try and get some information as well as other compounds go do. We can keep a survey of that. We put along 40 counties, which is responded and probably been over 95% of my think that's like 2 or 3 counties that were not out of it. And I can't explain why they would agree. I feel that strong evidence and my interest in it is,
we got it original. It's because they were approving the claims that
On a quarterly basis.
on a quarterly basis, they've already been paid. We were just the other extra set of eyes to look at it.
Board of Health is not meeting on it.
I got no problem letting them, all let them do it, but I'm just saying why we got it to start with.
Mhm.
As long as we're complying.
It doesn't change the paperwork, it doesn't change the accounting at all.
We'll do need to know when the meetings are and when they figure out moving back.
And they'll have to follow,
That we have to get the report done.
and they'll have to be by schedule, by our schedule. I mean, the finalization of the bill paying would have to be by our
I mean,
schedule.
we can, yeah. I'm trying to think how to do that. Yeah, because the system pays all the bills that are dated, like, the way we enter things now is they're all dated the last day of the month. Okay? So, then when we run check, we run it for all the bills through this month, 10/31, right? So it'll pick up all those and spit out all the checks. But see, now what we'll have to do is the claim form, the claim list are just run by the end date. So we run the end date. So we'll have to do some monkeying around, right, customer report to get the public health one to run. And then check-wise, we'll have to go into and any that are public health will have to mark as not paid. Or unless you're going to pay them the same date as the board meeting. So you're going to meet before the board meeting. Once the board meeting happens and everything's approved, Mary Ann just run all the checks. And they just spit out. There's no having to figure out which gets paid or which don't. But if there are claims in there for public health that were not paid yet, or paid at a different date, that's going to be sorting through and finding those and just unmarking them from payment, not approving them from payment.
Our Board of Health meetings are normally scheduled on the first Wednesday meeting of the month.
So we would have them approved each month.
The only time we deviate in that is a special reason to come from our department, such as we're working on our budget or something like that.
But it creates a problem because when we have a tax meeting on the first of the month, for example, it's not going to go through tax. I mean, it's not going to, how do I say that? If the committee meetings are early in the month, as opposed to later in the month, if the committee meetings are early in the month, the deadline for the claims is the prior week, which is in last month. So if that happens, then it's a problem. Would it be better if they paid their bills in the middle of the month and via separate?
Well, right now,
Check
you're
right.
approving them on the first Tuesday of every month, and the Board of Health meets on the first Wednesday of every month, so we're only talking about a one-day difference. Well, no, the difference would be cutting the check. That's what I'm not quite sure what, the issue, where it'll be difficult for us. And maybe the answer is just, you don't mind if your checks get cut the following Tuesday instead of, usually as soon as the board meeting has approved, then we cut the check. Well, your board is going to approve them on the first Wednesday, right? As long as you're okay with the checks not going out until we cut the checks for everybody the following Tuesday,
Oh, yeah.
then that, we'll just not make it a different,
I don't have your
separate check run.
John. I mean, right now, it's no different. It's no different than what we're doing right now. It really is.
Okay. Yeah, then that would be, we just, right, run the check for a week, because you're going to meet the first Wednesday, and instead of cutting checks on that Thursday, we're going to wait till the following Tuesday and just do one check run for the month. That's what we do.
I don't have a problem with that.
Okay.
If that's okay with you.
Right. The only thing is that then, when you meet on the first Wednesday, we'll need your claim the Thursday before, or Friday by noon, because she's got to be able to get them in and get the reports run. And if she misses the due date, then they just got to wait a week. If you're okay with that too. Yeah, okay. Right. It could possibly, it could be 13 days later. Yeah. Now, the only issue is if you're meeting on the first Wednesday and you're expecting financials to be done and accurate by that Wednesday, that's going to be an issue. Just like this, we just got claimed, right, I ran that report yesterday, the revenue and expense report yesterday. Well, there were claims that came in that weren't on the report, and then I had to rerun it this morning, so it was not complete yesterday.
She has them all in by the 29th, except two.
But what I'm saying is, like to be able to get all the reporting that you want for your board meeting done every month by the first Wednesday, like grant, labor, that's a day process, that can't all be done in time.
Okay.
That's all I'm saying.
Okay. So, that's something you and I can work out. But we won't, they're not, I don't think the intent is that, and maybe I'm wrong, but I don't think the intent is for the Board of Health to meet every month with the full Board of Health. The full Board of Health meeting will be quarterly. What does the Finance Committee,
We're creating a problem that we have to create.
yeah, more than quarterly. But it may not be every month, but the Finance Committee of the Board of Health will meet at least every month. So I wouldn't need the full report. What I would need is the claims list and the R&D.
Okay.
Do you think, does that make sense?
Okay.
Just like we do for health. So if it's on Tuesday, then the Wednesday after.
If you'll just give us a list of your dates, and then we'll back up and give you our due date.
That'd be great.
What's the desire of the committee?
All the law?
Yeah. It's creating a problem that we don't have right now, but if that's the law and he contends that's the way it needs to be, then we don't really have a choice. Correct?
Make a motion.
Mm-mm.
I think it's something that we should do. I'm comfortable that it can be worked out with the cooperation between the county and the Board of Health.
So how big of a delay is it going to create?
It won't.
Won't create any delay. Won't create any additional hours.
It'll change some hours, probably. There'll be more hours in the county.
I would make a motion that would comply with the state's attorney, what he suggested.
Is he, do you have minutes of his, is what he said written down someplace?
Should be amended on the special planning meeting.
Are we comfortable with, for a second to that motion?
Yeah, so,
Brad? So the motion is that the state attorney says how to do it, and then as far as the claims, he won't have anything to say about the accounting. But as far as the claims being paid by, or being passed by the Board of Health, and that's the way it'll be done. There's a motion to that effect and a second. On any further discussion? Questions? All in favor, say aye.
Aye.
Opposed, say no. Motion passed. Any other old business? Does that take care of it, Don? Any new business? Entertain a motion to adjourn.
So moved.
In a second?
second.
All in favor, say aye.
Aye.
Opposed, say no.